Hello, good evening. Uh, Today's topic is related to the basic part of parenting. And these parents, those who are in my tribe, may be looking forward into this topic. And this topic is very interesting and it relates to parenting. Now, today's guest in our Zoom meet that she is Dr. Chandralekha Madagam and she is from Karnataka. And today, what she's come up with that though she's a doctor, she's an Ayurvedic doctor and relates to Garbh Sanskara. And now let's ask her a few questions so that all the doubts of the parents will be clear. And those parents who have got some doubts, they can ask below the channel, and in the section below, they can put up their questions so that we can have a review later on, right? And so let's start, and let's call Dr. Chandralekha so that she can come up with the answers. Okay. Namaskar, Dr. Chandralekha. We are very happy and we are very enlightened that you have come to our tribe, and our parents will be benefited from your knowledge. And first of all, the first question coming up is that I would like to ask that what do you actually really mean by Garbh Sanskara? We know this. Technically, all of us know that we are Indians, but uh, in a deeper meaning, as you being a doctor and you deal with these things, I want that our parents should get a clear picture about it.
Okay. Yes, thank you for the wonderful introduction, Anita ji. And I'm very much blessed to blessed to introduce myself to you and your tribe also. I am Dr. Chandralekha. I'm a yoga naturopathy physician and Garbh Sanskara coach. I treat all pregnant mothers with Garbh Sanskara, Garbha Vidya, and all of this. Like we are training mothers to give the best children for this beautiful world. So this is our motto behind doing all of these things. So coming to your first question about what is Garbha Samskara, like words itself can explain the meaning very well. That Garbha itself means the womb, and Samskaras is like culturing or nurturing the child.
Okay.
So Garbha Samskara is nothing but we are nurturing the child. In fact, the mother and the father or the family is nurturing the child right from the womb. That means even before the baby is born, isn't it? So that is the main concept and intention of Garbha Sanskar. And why are we doing this is all because a seed can be rectified and not a tree. Once the tree grows up to a very huge tree, and then we cannot modify the leaves or the fruits or the taste, anything. But when we choose the seed, the right seed, we can expect the right fruits, maybe the right kind of height of the tree. Everything we can decide right from the seed.
Okay.
So that's the main concept behind Garbha Samskar. Maybe we can relate this with a proper agriculture mindset. So if we have a land ready, if the land's soil is very much fertile, if we are sowing the right kind of seed, if we are nurturing with good amount of organic fertilizers or water with good sunlight, only then we can expect a good tree to come up or good plant to come up and have best fruits for itself, isn't it?
Okay.
So that can also help many other people to have good and sweet fruits. Okay. So that's how, if a child is given with good environment in the child's womb, that mother's womb, the baby can take up those all nutrients like could be the physical, could be food nutrients also, and culturing from the mother. It could be good qualities or positive environment. All of this can directly influence the child's mind, and what mother goes through, everything the baby also goes through. So that is how we are culturing the child. So that is how we are training the mothers to take up this wonderful challenge of Garbha Samskara to have better future for our world.
Okay, wonderful, wonderful. That means, in short, you mean to say that Garbh means the womb of the
Yes.
mother, and
Yes.
Sanskar means the kind of environment we are giving the child before birth.
Yes, exactly.
Right?
Yes.
Exact means you can say that we can shape the destiny, or you can say the shape the personality of the child in the womb.
Yes, perfectly.
Very nice, wonderful.
Yes.
Wonderful.
So I usually tell that you are the creator of your baby's destiny. Like how Swami Vivekananda tells you are the creator of your destiny. Here, mother and father, that means the parents are directly creating the baby's destiny by following a positive and good lifestyle, especially in pregnancy. This can be related very well.
Excellent, excellent. So it's I'm really looking forward into going deeper into your topic, because maybe my tribe also may be waiting for these answers. So from the point of view of the parents in my community, I would like to ask that there are various complications these days in the children. You know, the younger children. Previously, we had diabetic adults. We never
Yeah.
even heard that small children also are diabetic patients,
Hmm.
asthmatic patients. Some have got blood pressure issues also.
Yes,
Their
yes.
anxiety, like they're full of anxiety issues. So
Hmm.
these things were not seen before
Yes.
in the previous years,
Hmm.
but recent years it is coming up.
Yes.
These things are very prevalent in the society. So
Hmm.
how can do you think that this Garbh Sanskar or this kind of science can help such children?
Obviously, it's like how I was previously telling about the seed. So could be like you just named a few, like it could be juvenile diabetes, asthma, respiratory disorders, allergies, or hypertension. Some
Yes.
people have some
Hmm.
psychological issues, could be
Yeah.
anxiety, depression.
Yes.
Some have other issues. So some also have some physical deformities as well, isn't it? So these kind of problems right away start from the womb. Okay, actually, these grow up to be complications after the birth. But all these problems actually started from the womb. So,
Hmm.
how can we tell is, for example, if a mother is having diabetes in her pregnancy, then there are higher chances that the baby also can start developing the diabetes symptoms in the earlier phase of the child, or later on, like in 40s, 30s, also the child can get, because genetics of the child are influenced with the lifestyle of the mother. This is called as epigenetics.
Yes.
So
Yes.
advanced science, and now we are finding many results from this, that the lifestyle of mother, what she practices during her pregnancy, is influencing the child so much that even a huge amount of pollution she goes through during her pregnancy is also influencing the child's genetics.
Oh.
So that is the amount of advancement technology we have within ourselves, isn't it?
Hmm.
Like if a mother undergoes a lot of stress during her pregnancy, there are higher chances that the child is anxiety ridden or depressed or not able to bond with the same age group children or parents. So these are some common factors where we can relate the problems of today with a pregnancy. So it's very simple to understand. If we change or if we correct the problems which a mother is facing during pregnancy, then obviously we can change or prevent all the possible problems in our children, isn't it?
Okay.
So when coming to treating the children, so we can only manage the symptoms, that's all. And treating completely is a little cases we can do, but not everybody. And those children grow up to have those problems throughout their life, which is a burden for them and also their parents.
Oh.
Yes,
And
like for example,
they may be non-treatable diseases also.
problems too. Yes. For example, I'll give a small example. If a child has asthma,
Hmm.
okay,
Hmm.
and if everybody in the classroom is playing very well, like a football or some physically active game, and this child has asthma, maybe this child cannot mingle with them,
Yes. Yes.
isn't it?
Oh,
So that
obviously.
becomes like an obstacle to the
Yes.
child.
Very true. Very true.
Yeah, so that's how following a positive and good lifestyle during pregnancy can give a better health and better, just not physical health or mental health, but also can implant good qualities to the child.
Okay.
This is a one versatile thing what we can give as a best gift to the child.
Right, right. And they many parents may be curious about knowing that what kind of treatments, or what kind of ways in which you deal with the parents, those who approach you.
Yeah, there are actually multiple types of things. Like many mothers and like many couple come to me with infertility with many problems like
Okay.
PCOS or increased weight or
Mm-hmm.
much stress with them,
Mm-hmm.
or some do not have any kind of physical problem, but still they are infertile. Maybe they are not able to conceive very well
Oh.
or very soon. So when we go deep into the roots, what was the problem? Then we found out stress was a major problem which is causing so many issues with that. It's just not the physical stress, but mental stress could be like their financial stress or emotional stress or relationship stress. So the stress could be many dimensions. So first we have to find what is the problem with that. When we start treating the roots, only then we can start treating the problems well. So that is how we have to connect with this. So some women come with some biological problems, like some major, like right now the most problem like women are facing is the PCOS, polycystic ovarian disease.
And I've heard people like mothers saying that they have got BP issues,
Yes,
blood pressure issues. I think it impacts the growth of the child. Is it like that?
obviously. If a pregnant mother has hypertension during her pregnancy, it can directly influence the baby's heart and the kidneys. In fact, the baby's health is itself in the risk.
Yeah.
So, women with like pregnant women with hypertension are called as eclampsia or pre-eclampsia. This condition of pregnancy is to be maintained very much well under the supervision of doctors. So they are not supposed to go somewhere alone. They have to be under the supervision because their BP can get fluctuated very like anyway it can go up and down. So even the delivery should be done properly. Like usually it goes with C-section because blood pressure cannot be maintained as surveillance normally, isn't it?
Yes.
So that's why.
Normally, the people whom I know, some cases came to my knowledge that whenever the BP shoots up, the doctors got to go for the delivery of the child, whether
Yes,
it's
yes, because it is more hazardous for the child to go with so many blood pressure alterations because that is affecting the fetal circulation, right? So that in turn can become a problem to the child and both the mother also because she is the one who is going to give birth to the child and she should not be in risk, isn't it? So that's how
Okay.
doctors are dealing with that, right?
Okay. So, like, suppose a mother is pregnant or mother is expecting a baby. So, what do you think? What kind of precautions and what kind of treatment? And suppose they come to you for the counseling and all. What is the duration in which you can help them?
Yeah, so people come to me in three different phases of their life.
Okay.
So one could be with preparation. They are planning for a baby.
Okay.
So for them, we give Garbhadan. So we are making completely preparation, like today, physical preparation, health-wise preparation, and mental preparation.
Okay.
So we give them all the modalities like Garbhadan. So where we can, so there is another concept called as Bija Samskara. So we in turn help them to purify their bija, that is the sperm part of the male and female part is ovum. So we help them cleanse it properly.
Okay.
There are some advanced techniques like, yes, there are many techniques which can help it. So we are in fact, so as I told in the beginning, like we have to treat the seed. So the same thing is applied even to the humans also.
Right.
So that is Bija Samskar for people who are coming with planning phase. And some are already pregnant and they come up. Okay. So for them, what we teach is Garbha Sanskara. Like we are giving Garbha Sanskara, how to give those samskaras to the child in the womb and develop all those things. And the third variety is they already have children and how to handle good bonding, good parenting, how to teach them like how to grow the children in a proper way. So these are like three different kinds of people come to me. And the rest of them come with normal, regular lifestyle based problems. But I more like usually more focus on this pregnancy and Bala Samskar and Garbhadan.
Right. So now the question comes up that if a customer or a mother wants to contact you online, if they are not living near your place, right? Like we are in North and you are based in the southern India. So how can patient or the mother, expecting mother, can reach you?
Yeah, we have our website. They can register from there also, or else they can directly contact us on a mobile number or email. Anything they can do, and they can come to first one-on-one consultation. We can specifically know what is their hurdles or what is their problem specifically, and we can give separate protocols like how they have to start, like what kind of yoga they are supposed to do. Initially, if they have any problems like PCOS or obesity or stress or any other issues like hypothyroidism, this is the most common problem.
You may be coming up with the strategies to
Yes,
help.
yes, it is tailored according to them because problems are different, the solutions are also different, right? So some have some specific problems, then we give some tailored like schedule or something how to follow, and we keep on following it, following every week. Then we can find the good results. We also provide yoga classes, pranayama sessions, and counseling session, diet charts. Like basically, what kind of lifestyle they have to follow, how to improve their bonding with their husband or wife. Or
Yes. So, in a sense, you want to say that you prevent those parents to take less of medicines. Medicines, is it like that?
yes, yes, yes. Medicines and sense, I would prefer not to completely depend on allopathy, but it should be like a holistic system. We help with naturopathy, Garbhadan, Garbh Sanskara, everything. And if they're already chronic with their problem, they can use their medication and also take support from ourselves, like our system.
So you
So
mean
that
to
it
say,
will be holistic.
you mean to say that the support system of both the things can go side by side.
Very well, yes. It's not like completely, if you're following naturopathy or yoga or something, you should not be taking medications or such. So you also have to consult your doctor or endocrinologist. According to that, also you can do the lifestyle based modification, which can give good prognosis or good results for the patient or the client.
So that means you can say those mothers, those who are already consulting the doctors, can also approach you.
Yes, yes.
There is nothing of that sort that you are
Nothing
a separate thing or
Yeah,
nothing.
yeah.
So
It is like a holistic
that
system.
makes the mothers more comfortable, so that
Comfortable.
yes, so
Yes,
that they can step in your course also.
yes. It's easy
To
for them to handle,
yes,
isn't it?
to give it a holistic type, and they can have a
Mm.
healthy baby, and the mother can also be healthy.
Yes, yes. In fact, everybody cannot do yoga. So we
Yeah.
also ask, for
Very much.
example, women with pregnancy, we ask them to go for all the antenatal checkups or go through all the scannings, blood analysis, everything they go through with the doctors. We help them with Garbh Sanskar, lifestyle, diet, etc. So that's how we play our role in their
So
pregnancy.
so by the help of this Garbh Sanskara, you can modify the nature and behavior according to the parents' wishes. So that if they want,
Obviously.
you know, intelligent child, or if they see the problems or defects in their personality, they can rectify it. Is it?
Obviously, yes.
Yes.
Yes. First, we ask them to inculcate all those properties and qualities within themselves first.
Okay.
Because even if the baby is outside or inside, it only looks at the, like, it observes what we are doing rather than what we are just preaching.
Okay.
So if they're expecting their child not to tell lies, then mother and father has to follow it first. Then baby obviously learns the same qualities.
Okay.
So that's how. So samskaras are to be first inculcated within us, and then we can shift those samskaras to the child very easily.
Fine. So, if some parents want to contact you, or want to have a treatment from you, counseling or something, do you have different parameters for that, or you have got one course or something?
No, there are different things. As I told, for planning it is different. For pregnant mothers, it is different.
No,
For
the courses which you offer.
offer, yeah,
Can
like
the parent decide that which one will be suitable for them?
yes, obviously they can follow because there are different levels which they can go through. There are like first there is silver membership, where they come in, they can watch all the courses. They have consulting, they have courses, they have mentoring. So everything is there for them. They even have community support because community or same kind of environment creates good environment for them to follow properly. So that's how. And the gold membership is where we have more hand holding and they can follow in specific, and we have particular follow-ups maybe in once in a week like that.
Okay. So I would, Dr. Chandralekha, we would like to, request you that you put your WhatsApp link and your Calendly link below
Sure, sure.
the YouTube, and so that the parents who are interested to take your services will directly contact you on one-to-one
Sure, sure.
basis.
Yes.
Right.
Yes.
So, thank you, Dr. Chandralekha. We are very blessed and we are very thankful that you have come to our platform. And I hope the parents might have got lots of golden nuggets and might have got a little bit of idea about Garbh Sanskar. And if they are interested, they should contact her. And all the contacts are given below the YouTube.
Thank you so much for creating wonderful
Thank,
opportunity
thank you
in
so
helping
much.
many mothers. Yes,
Yes,
thank
we'll
you
be
so
meeting
much.
again, and if my tribe wants you again, we'll invite you, surely.
Obviously, yes.
I
Thank
hope
you.
you will not mind coming back.
No, 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 never.
Okay,
Thank
bye.
you. Yes.